744. Dr. Kristen Simpson with Simpson Dental Associates is here this morning.
Yes.
If you have a question for the doctor, you can call 1-877-924-7888. And while we wait for some phone calls to come in, first let's talk just a little bit about snoring. I'm sure you get asked about it a lot.
We do.
How can you stop snoring?
Yes, a lot of times we get the complaint from the spouse who wants to know how the snoring can stop. And it's either a medical or a dental issue. So you might have to go and have a sleep study done to verify which one it is. But most of the time, if it's a dental issue, it just means that your airway gets constricted, which a lot of times your jaw can fall back. Like if your lower jaw just kind of drifts back, it can cut off your airway and decrease the air that you're getting and cause you to snore. So a lot of times just having an appliance that you can wear at night that'll bring your jaw down and forward will help to open up that airway and keep you from snoring. So it might be something just as simple as having an appliance to wear. Sometimes, you might need something a little bit more like a CPAP machine, but that's what that initial study will tell you.
We got a call from a lady last week who was absolutely terrified of going to the dentist. And it was kind of a different phone call. We don't usually get calls like that.
Yeah.
But I think that there's been a lot of advances in dental technology, maybe so people don't have to be as nervous nowadays to come in, right?
That's very true. Yes, there have been so many advances in dentistry. For example, digital x-rays that make it so you're not getting as much radiation when you have x-rays taken. There are advances with different instruments, like rotary instruments, that make procedures go faster and are a lot easier on the patients. Advances in some of the medications so that numbing is a lot easier and more effective. Sedation dentistry. So if you are still, very afraid to come, we can just use sedation. And of course, advances in things like computers. The computers can design some of the dental restorations, and even like 3D scanners can help a lot in treatment planning.
Okay, let's open up the phone lines. We got a call from Eva. Eva, good morning. What's your question for the doctor?
Yes, good morning. My husband, he's like 47, and his wisdom teeth are coming in, and they're hurting him real bad, and he will not go to the dentist at all.
Okay.
So what can we put on his wisdom teeth to make him, feel better?
Well, ultimately he does need to have the source of the problem treated, which means he does need to go to the dentist. He could try some Oragel or rinsing with like a warm salt water, something like that could help until he can get up the courage to make the appointment to see the dentist. But really, he needs to go to the dentist to make sure that there's not any infection there or, other issues that could be more significant going on there.
All right, let's talk a little bit, toothpaste.
Yes.
You walk into the aisle there in the grocery store, and there's all kinds to select from. What are some of the best?
Well, that's a good question. It can be a bit overwhelming. You just want to make sure that the toothpaste has fluoride in it, which most of them do. Kind of look for the ADA seal of approval, and that'll mean that it has the fluoride in it, and it'll be good for you. Really the toothpaste just kind of freshens your breath or might help with like sensitivity. It's really the mechanical action of brushing that gets rid of the plaque that's right along the gum lines. So, a lot of times people will ask me if the whitening toothpaste help, and you really don't see a whole lot of difference with those. Really the best thing to do is whitening in the office, and you get really good results with that.
What about baking soda?
Baking soda? Yeah, people use that some to clean teeth,
My mom was all about that growing up.
Yeah.
She was all about the baking soda. All right, Dr. Simpson, thanks for coming in today.
Sure.
Coming up next, there's still a lot of news.